Hi there, Todd Cameron here, GP and Medical Director at M3 Health. This message is for all of the people in our community that participate in kids sport, obviously the parents, the coaches, etc. I've got three children, 10-year-old, 13-year-old and 15-year-old, all deeply enmeshed in the society that we live in with lots of sport, dance, all that kind of stuff. So I'm just going to chat to you about coronavirus and what we know now as COVID-19. COVID-19 is simply the disease that you get as a result of an infection by SARS coronavirus 2, the name of the virus. A couple of things that are really, really important with this. We need to teach our kids habits that germaphobes would be proud of, and they need to adopt them really, really quickly. What appears to be clear about this is that children under 10 remain very, very well and perhaps are not unwell at all when they have it. There have been deaths in children from age 10 up to adults, and as we know from what we've seen in the press, that as you get older or you have more significant other morbidities, be that asthma, chronic lung disease, heart disease, diabetes, the likelihood of you having a serious outcome from an infection is much, much higher. So this video is to help you to understand what it looks like and what you can do in terms of really simple things to completely reduce the spread, reduce the impact on our health system, and keep you and your family safe. That's all my priority is with this video. So the first thing is to realize this: you need to forget all thoughts you have about a flu. This is not the flu. The flu is a bug that we know really well, and in a good year with the flu, 2% of the population get it. In a bad year where there's the health system struggles, about 11% of the population get it. The onset of the flu from contact is really quick, as all of you will know. Typically a day or two after you've been in contact with someone with the flu, you become unwell, and then you usually self-isolate because you feel pretty sick. That's how the flu typically rolls. But as I said, 2% in a good year, 11% in a bad year. Projections with this virus say that between 40 and 80% of our community could become infected because nobody has immunity. It's a new virus. You only get immunity through being exposed and recovering or having a vaccination / immunization. Those are 18 months away in the best case scenario. So our job is to manage the time between now and then as well as we can and keep everybody safe. So the things that keep people safe are good personal hygiene. So avoid touching your nose, mouth and eyes. Regularly washing your hands with soap and water is better than alcohol hand wash. Alcohol hand wash will suffice if you're out and you can't get access to soap and water, but make sure that you use soap and water regularly, 20 seconds, so that's enough time to sing happy birthday twice. And yes, I do recommend you do three hip hip hoorays for each happy birthday. So do that. Make sure that you're not touching common surfaces that other people touch. Shiny surfaces, don't stay away from touch screens anywhere. If you do need to touch a touch screen that is not your own phone for some reason, make sure that you wash your hands as soon as practical afterwards, and do not touch your eyes, nose and mouth. 1.5 meters is the ideal distance between people as a minimum. Now in kids sport that's going to be hard to do, but if kids are running around it's probably less relevant. But I want you to please promise me that you won't do the team huddles. Those are out. All the kids at quarter time, half time, whatever it might be, should be 1.5 meters apart. That's a relatively big circle. No kissing, no hugging, no shaking hands, no high fives, no touch between people. Keep your own drink bottle. If you have a common drink bottle that looks like other people's drink bottles, then make sure you label it and that it's clear that it's yours. Keep it away from the others. Don't stick them all together this time, and allow good separation of people as they're observing these events. I think we're going to find very quickly that a lot of these kids events are cancelled, including school, and we're going to find ways to entertain our kids. I think there's a great opportunity here for all of you that are coaches to actually put together a YouTube channel. I strongly recommend you set up a YouTube channel and actually start putting together some drills and some fun stuff for the kids to do. They're going to be at home probably annoying each other a fair bit, but let's get them working on things that are proactive and keeping them fit and healthy and reassured. In an uncertain future, the best thing is to have a certain plan. Get to the plan, make sure that you're following these points, Your priority right now is safety for you, for your community, for your family, and for your team. Thanks. I've been Todd Cameron. Have a great day.